Confidence in your skill comes through numbers.
You stepped into ophthalmology just like your father. Did he encourage you or was this your only plan?
So naturally, as I kept seeing my father be an ophthalmologist, I used to visit the practice every now and then. I used to see the way he used to do surgeries even when I was a child. I was very inspired.
What is Presbyond and how it differs from the other laser refractive procedures?
The unfortunate part is that Presbyond gets lumped in with all the other corneal refractive surgeries for the treatment of presbyopia, which don't work.
How does YOSI is helping young ophthalmologists to chart out their career in ophthalmology?
To be very frank, is an indispensable platform for young ophthalmologists to chart out their careers.
First comment is, sir, my dad has diabetes but no vision issues. Does he really need an eye checkup? Welcome to the third episode of EyeConic Journeys. In today's episode, our special guest is Dr. Aadithreya Varman, who is the medical director of UMA Eye Clinic. In today's episode, we had a lot of discussions regarding Young Ophthalmologist Society of India. Then we had discussion regarding his content journey and his ophthalmic journey. Then we had a segment in which we had queries of patients. And the third segment was like how a manufacturer and doctors can collaborate and come together to bring out innovations and a lot of improvement in eye care. So without wasting any single minute, let's welcome him on the podcast. Sir, thank you so much for accepting my invitation to be on this show. So the concept of this show is to share unique stories, as every ophthalmologist has its own story. So sir, my first question is, sir, you stepped into ophthalmology just like your father. So sir, did he encourage you or was this your only plan?
Okay, so you would have observed in the field of ophthalmology, especially in our country, there will be a lot of second or third generation ophthalmologists. I can tell you one thing. There is only the illusion of choice for the children. Okay, so the parent will always act as if there is a choice for them, but there is no choice.
Right, sir.
So it is understood that the child is going to take up ophthalmology, and somehow what we've seen in our practice as well is that patients are a lot more accepting of the family member who's joined the practice as opposed to seeing a consultant. Because when they're seeing the daughter or the son of the doctor they've been seeing for many decades, they feel very comfortable. So somehow that patient connect is there with the second or third generation ophthalmologists also. But on a serious note, for me personally, as a student, I was only pretty good at science. Maths was a complete no-no for me. I cannot even add 2 and 2 together. So I suffered a lot in my schooling with mathematics. But science came very naturally to me, especially biology. So by nature itself, I was more inclined towards doing science. So even if I had not taken up medicine, I would have been in the scientific field in some regard. So naturally, as I kept seeing my father be an ophthalmologist, I used to visit the practice every now and then. I used to see the way he used to do surgeries even when I was a child. I was very inspired. I also used to come to conferences like AIOS and all of that when I was a school-going kid as well. I was very inspired to see my dad take the podium and deliver talks. I was very fascinated by the science and the technology in ophthalmology because, as you know, technology is very... we'll just cut that part. Okay. Start again? Yeah. So, as you know, technology is a very big part of ophthalmology, and every few months you have a new technological advancement. So that was something I was also very fascinated by. So because of this, I was inclined towards taking ophthalmology. So I was also given the illusion of choice. The choice was there, but at the end of the day, this is what I had to do.
So sir, you are a surgeon.
Yeah.
But I have seen a lot of your beautiful content on Instagram and YouTube. So sir, you are a content creator too. Sir, what inspired you to share your knowledge and what unexpected skills you have picked up along the way?
Yeah, so that's a very good question. So once I started the practice, I finished my MS and I joined my father after doing a year of training. I realized even after trying to educate the patient so much, they still used to have the same questions and the same doubts over and over again. So they would have the same questions about cataract or the same questions about refractive surgery. They would think that cataract only has to be operated after it's become very mature, when they're almost blind. Or some patients used to think, okay, if I do LASIK today, in a few years my power will come back. So what is the point of doing LASIK? All of these myths were there. And I had to have a medium where I could reach to a mass potential of my patient pool and bust all these myths. So at least I can give them the basic information about the available treatments and about what they could do to correct their vision. So once they are given that basic information, then they come into the clinic and then they can ask their more nuanced doubts. So specific doubts can be cleared with the doctor. So the idea of me trying to create my content was to just get out the basics on the internet. So when a patient goes up and looks up something and they have been given that information via you through a format of a video. So that's very useful. So nowadays what happens to me is when I'm sitting in the clinic and let's say a patient comes to me for LASIK or SMILE, they get evaluated, they come down and they sit in front of me in the chair and I start to explain them everything. And they said, no, I know everything, sir. I've seen your video. That's all. So it saves a lot of time for me as well.
Yeah, exactly.
So, and the good part is, once I started making these content, the number of patients who had all of those doubts and all of those age-old myths that they had about LASIK or cataract, it's all come down. The flip side is now, they come and ask me more nuanced doubts. They come and ask me, okay, sir, I want only EDOF lenses now because you have explained that EDOF lenses will not have glare and halos. That can also be a downside because now they have unreal expectations. So there's a advantage and a small disadvantage to it as well. You have to be very careful with the kind of language and the kind of messaging that you put out in your content creation. And there is a certain responsibility that comes along with it. So that's the fine balance that I'm trying to find right now in terms of my content creation journey.
So, sir, you have launched your podcast. I have seen that podcast with Professor Dan Reinstein.
Yeah.
So, sir, do you think that podcasting will add value to this ophthalmic community?
Yeah. It's funny you say that. I have not actually officially launched my podcast yet. So that podcast with Professor Dan was completely unprepared for. It was just a totally off the bat thing. Because what happened was I went to the IRSI meeting in Amritsar, the winter meeting in January, and I happened to share a session with Professor Dan Reinstein. In that session, I realized that Professor Dan was visiting Chennai. He wasn't visiting Chennai, he was just transiting through Chennai for about 12 hours. And then I asked him, why don't you come and visit our center? It was just a very impromptu thing. And we decided just a day before to do a podcast. So there was no prepared script at all. Everything was off the bat. I had nothing in front of me before I started the podcast. But then I realized when I sat down with Professor Dan in the setting of a podcast, like an interview, and I started to speak to him, there were so many inspiring stories that were being told. He started off with how he started his medical career, what inspired him to be an ophthalmologist, how we innovated Presbyond, a very innovative refractive correction for the treatment of presbyopia also. And he even tied down his musical career along with his ophthalmic career, and he explained how music and ophthalmology have a lot in common. So that was a very eye-opening podcast, and I learned a lot myself. Even though I had spoken to Professor Dan on many occasions before, but when you sit down in a sitting like this, there's a lot of conversation and a lot of experiences that open up. That could be very relevant and educational not only to the audience but also to the people who are sitting down and having the conversation. So I feel it's a very conversational approach rather than sitting down in front of a camera and just speaking to the camera.
Right.
When you sit down in front of a person, you're able to get a lot more out.
Right.
And that content can be used in forms of clips or short form videos to put out into the public so they can be educated as well. So there's a lot of potential in podcasting. As you know, now in the current trend is when you go on YouTube, most of the trending videos are now podcasts.
Right, sir, right.
So I think people have realized this and are now shifting towards the podcast platform.
But sir, the podcasting right now trending in journal field, but industry specific podcasts are very less. I think.
Correct.
So sir, even you performed surgery on your father.
Yeah.
So sir, operating on a patient is one thing, and operating on your father when stakes are higher.
Yeah.
So sir, there must be a emotional challenge. So sir, how do you maintain a balance between a profession and the emotional challenge?
Right. So again, the confidence in your skill comes through numbers. That's
Right.
one part. And also by knowing what you're doing, essentially. So I would not have done the procedure for my father unless I had reached a certain number and things had become muscle memory. So there's a learning curve that you go through when you're performing a specific surgery. The first 100 cases or so, you're thinking about every step. So before you perform every step, you think once and your mind is telling you what to do. And then you break a barrier. Once you've broken the barrier, you don't think anymore, right? It's like how when you were starting to learn how to drive.
Right.
When you first learn how to drive, everything was very different.
Different.
You had to press the clutch, you had to shift into gear 1,
Right.
slowly release the clutch and then press on the accelerator.
Right.
It was very overwhelming when you first started. You had to think a lot before doing it.
Think for the gears, like
Exactly.
how to-
And then the car will stall, then you'll panic.
Yeah.
You'll try to switch it on again. But after about 3 months, 6 months down the line, you don't think anymore. It just happens. It becomes muscle memory.
Muscle memory.
So essentially, once the surgery becomes muscle memory for you, you stop thinking. That's when you really start to gain the confidence that yes, I can perform this on any patient, whether it is my own parent or whether it's a VIP, my friend. It doesn't matter anymore. So I had that confidence after breaking that ceiling of doing 1,000 cases or so. I'm not even sure how many cases I've done till now. So that's how it is. Then when I realized my father was a candidate for Presbyond, I knew, okay, my father's a perfectionist. So everything has to be done right.
Right.
So my father, by nature, he used to wear glasses right from the age of, I think, 15 or 14 or so. He was wearing glasses. I've always seen him with glasses. Okay. Even if you look at his older photos, he's wearing glasses for everything. His power prescription was maybe around +1. It was a very small number. So he never had the inclination to do LASIK before because it is a very small number, power prescription. When he really started to feel the burden of wearing the glasses is when he became presbyopic. So after the age of 42, when he developed the reading glass power as well, that's when he really started to dislike wearing the glasses because he had to use glasses for everything. That is the problem. But at that point of time, when he was 42 and he became presbyopic, there was no real laser method of correction of presbyopia. So that's why he had not undergone a laser correction at that point of time. Now that Presbyond had come, he underwent the evaluation. My dad was now currently 67 years of age. No cataract at all. Zero cataract. But he does have both a distance prescription and a near prescription. So he was eligible for Presbyond. We did it. I will admit, what happened was when I first came into the operating theatre and when my dad was sitting down getting prepared, I was a little nervous. It's your own father.
Yeah.
At that point of time, I looked over there. I thought to myself, that's my dad sitting there. Okay, what am I doing here? Am I really going to do this? So that thought comes. It's natural. We're all human, right?
Yeah.
But then we went on and then he sat on the table and I looked in the microscope. I can't see my dad anymore. I only see eye.
Aye.
So the same eye as everybody. So once you see the eye, your hands will just do the movement. That's all. So it just went on like that and it went really well. And the very next day, my dad went to the operating theatre and he did his cataract surgeries. I did the Presbyond for him on a Monday evening at 5 p.m. Next day, Tuesday morning at 8:30 a.m. Less than 12 hours later, he is doing his cataract surgeries. He did 7 cataract surgeries the next day.
Sir, very fast recovery.
Very fast recovery. That's what. So the funny part was I was not nervous that much while doing the surgery. The next day, when he went to the operation theatre to perform cataract surgery, I was nervous. I was thinking, oh, is my dad going to be able to operate very comfortably in the next few days? So I went to the operation theatre myself and I stood there. In case my dad is not able to do surgery, I have to do. So I was standing there ready to take over in case he's having difficulty. Zero.
He just performed
One after the other, 7 surgeries, less than 8 minutes per surgery, all done within a span of 1.5 hours.
1.5 hours.
Fantastic. And in fact, I asked my dad, I think you're doing surgery better than before also. The really interesting point was, my father was very convinced. After doing Presbyond, not only is his distance vision and near vision very good now without glasses, he says the colors and contrast is now much better than he had before. The colors are sharper. He's able to differentiate the grays and blacks much better now after the laser surgery. So laser surgery not only improves your distance vision and near vision, but can also improve your quality of vision.
Okay.
That's what I learned from this experience.
Sir, a lot of people don't know about the Presbyond. So, sir, what is Presbyond and how it differs from the other laser refractive procedures?
So again, this is going to be a long discussion, right? So the unfortunate part is that Presbyond gets lumped in with all the other corneal refractive surgeries for the treatment of presbyopia, which don't work. There are other methods of refractive surgery on the cornea which do attempt to treat presbyopia, but they all do one of the few things. They either create a central cone on the cornea or they create zones of multifocality on the cornea, both of which are bad ideas. Because when you create a central cone or you're trying to create multifocality, you're going to have contrast sensitivity loss and you're going to have light loss. This is the issue that we had with the multifocal IOLs. But the thing is, you're trying to do this on a patient's cornea when they have clear lenses inside the eye. So he's already having 100% contrast, 100% quality of vision. And then you go ahead and create multifocality in the cornea, they're not going to be happy. Presbyond does not do that. What Presbyond does is, it does a modification of monovision. This is not just monovision. This is the most important concept of Presbyond.
Okay, so one eye is correcting for distance and
other eye is correcting for near. But it's not that simple. So one eye for distance and one eye for near is monovision. What Presbyond does is, it's one eye for distance, but the distance eye also gets reasonably good near vision.
Okay.
And the other eye is mostly for near, but the near eye also gets reasonably good distance vision.
Distance vision.
If one eye was only for distance and one eye was only for near, you would have a lot of cross blur. That is, both the eyes would fight with each other to try to find the correct visual range. But that's not what happens with Presbyond. It's actually both eyes for distance, both eyes for near, one eye little more distance, one eye little more near.
So, sir, it's like increasing depth of focus.
Exactly. It's increasing the depth of focus by titrating the amount of spherical aberration.
Okay.
Spherical aberration is, to be very simple, is a naturally occurring optical aberration. If given in a certain range, will increase the patient's depth of focus. If it's too much or too little, it will not work. But when you do it at the correct range, the patient sees very well because of the increased depth of focus. So what happens in Presbyond is, let's say the distance eye, if a patient has got, let's say 6.6 with best correction and his near is only N18 uncorrected. Post Presbyond, the patient will get 6.5 for distance and the near unaided will become N10 without correction.
Okay.
Whereas the non-dominant eye, if you put minus 1.5, right?
Right.
With a lens, near will be N5, but distance will be only 618.
618.
Okay, but in Presbyond, what happens is, because you're giving the spherical aberration along with the minus 1.5, near is N5, distance will be 69 parts. So there is no cross blur, or there's very little cross blur in the first maybe 3 months, but the patient is able to blend the vision with the two eyes very well. So
when the synopsis,
exactly, so there's good binocular fusion. Because the discrepancy between the two eyes is very little. So basically, you're trying to reduce the discrepancy between the two eyes by giving a spherical aberration. So unaided, they are 6.5, N5 for intermediate, N5 for near. It's absolutely mind-blowing. The kind of results that we're seeing is amazing. It's a pity that Presbyond was not very popular because it's been available for the last 10 years. So what Professor Dan Reinstein mentioned was, it takes about 20 years for any technology to start being adopted by the general public. So I think we are at that curve now where Presbyond is now starting to become increasingly more popular, and people are awakening to this fact that this could be a good solution.
There is a theory in economics also, na, that 2.5% of the people are innovators, then there comes the early adopters, then late majority.
Exactly. So it takes about 20 years for any technology to really start to make its presence felt in the general audience. The funny thing is, now even the IOL companies are moving away from diffractive technology to the EDOF technology that Presbyond was talking about from last 10 years ago. All of these EDOFs now do the same thing by modifying the amount of spherical aberrations. So the industry is now moving towards that, as you can see.
Okay. So sir, you are an executive member of YOSI also.
Yeah.
So sir, how does YOSI is helping young ophthalmologists to chart out their career in ophthalmology?
Yeah. So now I think the Young Ophthalmologist Society of India, YOSI for short, to be very frank, is an indispensable platform for young ophthalmologists to chart out their careers. It's a very, very supportive organization. I think now we've got almost about 4,000 members, and it's very active. So the leadership is now taken a very supportive role, in which we are having activities which occur on a weekly basis. They cover all the aspects that a young ophthalmologist would really want to know. They cover practice development, they cover fellowship opportunities for young ophthalmologists to help them decide what fellowship to take. We have even a fellowship registry for you to go and look up online as to see which institute is now available to undergo a fellowship training at. The amount of support and the amount of help that the members will get from the YOSI leadership is unprecedented. So my role currently is I take care of a very particular subset in YOSI, where it's called the Refractive Focus Group, where I'm trying to make workshops, and I'm trying to put out webinars to help educate the members of YOSI who are interested in undergoing refractive surgery training. But that's a very small part of what YOSI does. YOSI is all encompassing, and everybody is welcome. And the barrier to entry is very little. So if you're a member of YOSI and you would like to get podium presence, like to be more involved, like to be more educated, you want to learn more about practice development, or you have any issues at all, the governing council is very open to you, and members can approach any time to get any query sorted. So I think it is now an indispensable platform for any young ophthalmologist in the country to be involved with.
Sir, it will increase that collaborative spirit among young ophthalmologists.
Exactly, yeah. And now what's happening is YOSI is also tying up with all the other national and international societies. A lot of MOUs being signed with national organizations in our country, and also with the international organizations such as APAO, where YOSI is given a separate podium, a separate hall to conduct all of the sessions, and everything is now going at a full swing. We really have to thank the governing council and the leadership for all of their innovative efforts to make ophthalmology more accessible to the youngsters in the country.
So now let's move on to a segment of the podcast which is related to patient education. I want this segment to be fun and interactive. My first segment is a prescription for a friend. Right. I'll give you some of the patient queries which come in the comment section. Right. So sir, you have to give a proper and a quick advice. Give what will be the best advice for that patient. So sir, my first comment is, sir, my dad has diabetes but no vision issues. Does he really need an eye checkup?
Yeah, absolutely. So as a rule of thumb, we tell all of our patients, if you are diabetic, a yearly eye checkup is absolutely mandatory. Okay. You have to obviously follow up with the diabetologist to ensure that your blood work is all in check. That goes without saying. But you don't know what's happening inside your eye unless you get it checked. Because when you have diabetes, especially if it's uncontrolled, there are a lot of ill effects that can happen in your eye. Most commonly, you can have dry eye, you can get cataract, you can also get something known as diabetic retinopathy. That happens when the small vessels inside the retina start to get damaged, they can bleed. This can cause some amount of irreversible visual loss also. As you all know, prevention is always better than cure. So in case we're able to detect this at an early stage, if you have very mild retinopathy, we can just advise you to manage this conservatively. Or if you're having a mild amount of swelling, it can be managed with injections and lasers. What's really difficult is when you come to us with an end-stage disease, as in if you've got end-stage diabetic retinopathy, you have retinal detachment, that's when the vision cannot be brought back to its 100% nature. It can only be partially restored. So having an annual checkup, or even better, if you can even come every 6 months for a checkup, it's nothing better than that. We can always detect things earlier and ensure that you don't have any permanent, irreversible loss of vision.
Loss of vision.
Yeah.
So second statement is, I love swimming, but I wear contact lenses.
Yeah.
What's the safest option for me?
Okay. So again, there's a lot of debate here. Many people think, okay, I want to avoid the risk of a laser, but I keep using my contact lenses. So this is a total fallacy. If you're using contact lenses, you obviously do not want to wear glasses, correct? That's taken for granted. But statistically, the risk of you going blind by using contact lenses for 10 years is much more than the risk of going blind by doing a laser. Okay? There's a small risk with anything, but you're taking a bigger risk for your vision if you continue to just keep using contact lenses. The safest option is to undergo a laser. Laser, right now, whether it is LASIK or SMILE, is a time-tested, scientifically proven modality to correct your vision. It's not debatable anymore. The statistics are always there for you to look. You must not be following anecdotal claims being made on the internet. One thing that we must realize is, on the internet, negativity sells.
Right.
You will always find that
Negative news spread faster.
Yeah, so negative news always spreads faster. And the small percentage of patients who are not happy with the LASIK outcomes are always the loudest ones. Right? Or even if they're happy with the LASIK outcomes, they only make a negative comment so they get more traction. So that is the unfortunate part of it. But if you go through the data, if you go through the peer-reviewed evidence, if you actually make the effort to research, you will find that statistically, LASIK, SMILE, or all other proven forms of laser vision correction like ICL are extremely safe. There is a small risk to it, but the risk is negligibly small. There's also a small risk when you drive a car. When you're driving a car every day, you take a small risk that you're going to crash. But does it happen? It doesn't. Most of the time, you're okay.
Right.
So we have to really change our thinking now, and we have to realize that at any given point of time, there's enough data, there's enough statistics for you to take an informed decision. If you don't want to take that small risk, well and good. Continue wearing your glasses. But my advice is, don't take anecdotal evidence and things that are put on social media just for views and traction as actual statistics. Look for the actual statistics, then make your decision. So then you will understand that getting a laser done is much safer than wearing contact lenses every day for 10 years. So that's my message. Yeah.
Sir, the next statement is by a mother. She has commented that my kid watches cartoons on a phone for 3 hours a day. Should I be concerned about his eye health?
Yeah, so again, this is a very pertinent issue that we all face, that even I personally face every day. And my kid also wants to watch cartoons all the time.
Right.
So nowadays they see us using our phones, they also get accustomed to using their phones, they want to see cartoons on their phone all the time. Now, cartoons or using the phones per se is not directly linked with myopia, but there is some evidence which says that if a child is always doing some work at a very close distance for many hours during the day, the chances of them myopicizing is little higher. Because as a child, if they're only doing activities at the close distance, the mind thinks, okay, the whole world is only here. So if the whole world is only here, I want to see better at here only. So the eye starts to get more minus power, because the more minus you are, the better you see at near. Right? So what you can do is you can try to reduce the amount of gadget use. You don't have to eliminate it completely. At least try to extend the range of distance. Right? Maintain a healthy distance.
So, sir, we can say that if they are watching cartoons on a TV.
TV, yeah. It's fine. So at a TV distance, it's fine. So maybe limited to not more than an hour a day. Encourage the child to always go outside, get more sun exposure. The more that they keep looking into the horizon, more looking into the distance, into far away objects, the lesser the chance of the eye getting myopicized. But that's not the only factor. The genetic factors also contribute. This is the most that we can do. By the end of the day, if the child is myopicizing, we have to take adequate steps. We have drops which will reduce the amount of myopia. And there's also special glasses to control myopia which can be given to the child to at least reduce the progression. By the end of the day, if the child is going to get minus power, they're going to get it and it's going to keep increasing till the age of 18. After the age of 18, if they don't want to wear glasses, they have a lot of solutions. But just follow these basic rules. Go to the eye doctor at least once a year to ensure that the child's correct glass prescription is being given to them. That will ensure that the vision is healthy. Any other corrective methods can be done after the age of 18. That's all.
Sir, now let's move on to the another segment.
Yeah.
It is diagnosis dilemma. So I will give you a statement.
Yeah.
And you have to diagnose it. What problem the patient is having.
Perfect. Yeah.
So, sir, the case one is a 42-year-old banker complains of frequent headaches.
Yeah.
Blurred vision after reading and difficulty focusing on near objects.
Yeah.
Sir, what's your diagnosis?
Yeah, so this is very common. Usually after the age of 40 and once you've gone to 42, 44, you start to feel the ill effects of presbyopia. So presbyopia, to be very simple, is a natural process that occurs due to aging, in which the lens inside our eye, which is known as a crystalline lens, gets stiffer and it can't be as elastic as it used to be in a younger age. So when it's not as elastic, it is not able to get more spherical. When it gets more spherical only, you're able to read little better at near because the depth of focus increases. So that ability is lost due to age. So as we lose that ability, we need to depend on reading glasses. We usually start at the +1 and it keeps going up to +2.5 as we keep getting older. So the patient is probably presbyopic in this time. They need to start wearing the reading glasses and keep going to the eye doctor every 1.5 years or every 2 years or so, because the power is going to keep increasing. If you don't use those glasses, the patient will have headache, eye strain, and all the symptoms that you just mentioned. Other option is, if you don't want to wear glasses at all, undergo Presbyond and you won't have to wear the glasses. Yeah.
Sir, case 2 is a 30-year-old IT professional reports eye redness, dryness, and a burning sensation, especially after long screen hours.
Yeah.
Sir, what's your diagnosis?
Again, this is a typical patient I see almost every day in my office. So what we are facing here is most likely dry eye. So as you know, our lifestyle nowadays demands a lot of screen time, a lot of screen use, looking at the computer, laptops and whatnot. So what we have to understand is, in our eyelids, we have glands which are known as the meibomian glands. These are the glands that are responsible to keep our tears healthy, right? So they have to be expressed. And how are they expressed? By blinking. Only when we blink at the correct rate and with the correct force are these glands expressed and the tears are kept healthy. When a blink rate drops, the glands are not expressed properly and they start to get blocked. And the tears on the eye will dry up very fast. Why does this occur in IT professionals very commonly? Is because they are sitting in front of a computer in an air-conditioned environment and they're doing work with concentration. So the rate of blinks comes down and the force with which they are blinking is also come down. They're only doing half blinks. Because of which the glands get blocked, tears become unhealthy and they dry up very fast. This only keeps getting worse with time. So a very common thing that we see every day in a clinic We usually treat this by giving them some omega-3 capsules. We give lubricating drops. We also explain about warm compress. That's when you take at least 10 minutes away from the screen every 1 hour. Take a warm towel and gently just massage the eyelids. When you do that, the meibomian glands will get a little healthy and they'll start to function better. So this is a very common issue. If it's not getting better, even with the medication, we have other treatments known as the LipiFlow, in which we're able to use a device which can actually clamp the eyelid and express the glands with gentle heat and pressure. So that's what we do for these people. It's a very common issue we face nowadays.
So due to that screen time.
Exactly. It's because of the prolonged screen use. When you're doing a work, a lot of concentration, right? Your blink rate comes down. They can't avoid screen time. It's the job.
Yeah, it's the job.
It's the job. So what you can do is take at least maybe 10 minutes away from the screen every 2 hours. Do the warm compress and apply the lubricating drops every 2 or 3 hours.
So there are computer glasses in the market. So are they a good fit if they...
No. So those glasses, again, they're not very scientific, right? They say they block UV light and all of that, but again, there's no real proven evidence that shows that it actually prevents dry eye.
Dry eye.
It might give you the feeling of being more comfortable because it might make the colors appear a little warmer. That's about all. But it does nothing to increase your blink rate.
Blink rate.
So the underlying pathology is the low blink rate and the half blinks. We don't blink with enough effort. So that's the main cause behind this. So these glasses are not really mandatory. Just follow the simple rules of hot fermentation and lubricating drops every 2 or 3 hours and you'll probably be alright.
Sir, last and final case, a 10-year-old child sits too close to the TV and squints while reading and struggles to see the blackboard.
Correct.
What's your diagnosis?
Yeah, so this is a textbook case of myopia.
Okay.
Yeah, so the moment a child says, I can't see the blackboard very well, you have to see the ophthalmologist. Not only that, I should say, as soon as your child is able, please bring them to an ophthalmologist, regardless of whether they are saying they can see well or not. They have to be checked whether they have a refractive error. Just imagine if a child has a refractive error of -3, they're only able to see up till about, let's say, 60-70 centimeters. But for that child, that's what is normal. A child doesn't know that he's supposed to see a lot better and a lot further away. So unless you get it checked, you will not know whether the child has a refractive error or not. So what happens is when the child starts to go to school and they are sitting in the last few benches and they are not able to see the blackboard, that's when the teacher notices, okay, the child is not able to see that well, and that's when the parents come to know. And then they come to us and then we are supposed to give them the glasses. What should not occur is, the child doesn't tell the teacher, child doesn't tell the parent, they have a refractive error, it's not corrected for many years, and then the child gets amblyopia or lazy eye. That is a permanent visual impairment that has occurred because the visual development has not occurred in the brain because of the lack of using of a correct spectacle prescription. That's what is really tough to treat. So that should be avoided at all costs. So the textbook rule of thumb is, regardless of whether you feel that your child's vision is perfect or not, go to an ophthalmologist every year because at a growing age, the refractive power can keep changing and keep fluctuating without your knowledge. So you have to give them the glasses to see well, right up to the age of 18. After 18, we can do anything or we can use any solution that we have to correct the spectacle prescription. So that's what we're facing here.
So sir, now I'll sum up this podcast with my last question. Sir, as we know that manufacturers and doctors are collaborating, but what's the better way to collaborate to increase the quality of the products to further increase the patient satisfaction?
Yeah, so industry collaboration with the doctors, I think, is extremely important. And it should not really be given a negative aspect, right? The moment you say that there's a lot of negativity surrounding it, the immediate perception is that, okay, this doctor is taking money from the company and that's why they're promoting the product. It's not like that. So we need to have a very healthy relationship with the manufacturers because, truth be told, we cannot do what we are doing without the scientific research, the R&D that happens in the side of the manufacturer. Today I'm giving very good results with Smile and Presbyond, but I can't do that without the R&D from Zeiss,
Right.
right? At the same time, I am also giving back constructive feedback about the performance of the machines, the how my patients are doing on a very regular basis. And the company also takes it back in a very healthy form, and they're giving this feedback back to the R&D team, and then they make it a little better and send it back to me. Very recently, what we've done on the VisualMax, which does the Smile on the Zeiss platform, is with some feedback with the company and myself, we've been able to fine tune the way that the cylinder correction occurs. Right? We have a way in which the cylinder correction is very accurately done on the VisualMax 800 machine.
Sir, it creates a feedback loop.
Correct, exactly. Right. So this constant healthy back and forth should be there between the doctor and the medical company, and the doctor must not feel compelled to just keep pushing one technology just because the company is collaborating with you or giving you a small fee because of your health. Whether the company is collaborating with you or not, you must be able to evaluate a technology without any bias and present your findings to your colleagues and to the medical companies as well. So that's when you keep improving on that said technology, and ultimately who's benefiting? The patient.
The patient.
Right. Results keep getting better and better. So even though I'm using Smile, just do that again. So even though I've been using Zeiss products for many years now, I'm always sitting on the company's representatives and telling them what they can do better.
Right.
Every time I meet them, I give them a list of this should be improved, this should be improved, this should be improved. And they take it back very seriously. So I think this kind of healthy partnership between the doctors and the industry is very important to take the field forward, and ultimately our patients keep getting better and better results.
Right.
So what I'm seeing today and what I'm seeing 5 years from now, there should be a lot of difference. We should see a lot of improvement. And I have seen that in the last 5 years, and I'm very happy to keep improving the technology and keep improving our results.
So sir, are Indian manufacturers in that race?
1000% yes. We must really not put down our Indian manufacturers at all. Unfortunately, there's a bias. We always think the imported lenses are better. Even the patient thinks that okay, if I get an imported IOL, or if I get an imported ICL, that's going to be better quality of vision. I can tell you right now, there's one lens that I use for my cataract surgery patients, and I like so much. It gives amazing vision for distance, intermediate, and near. It's being made by an Indian company, right? And sometimes when my patients come and tell me I want a premium lens, and they select a premium package, and they ask me what lens are you going to put, I won't tell them. I'll tell them, don't ask me what lens I'm going to put. It doesn't matter whether it's Indian or imported. What matters is that I am the one who's doing the surgery.
Yeah.
So I'll be the deciding factor. You should not be worried about the lens. You should not be worried about the company. Nothing. Just see what vision you're getting. That's all. And once you tell them that, and then they see the quality of vision, they're convinced.
So that's a very good way to create your brand also, because you're telling the patient that you are coming in hospital because of me.
Exactly.
Not because of the product.
Correct.
If you can come for the product, you can go it anywhere.
Exactly. So sometimes when I have a patient who comes to me and says, I read online, this is the best lens, I want this lens. You know what I tell them? You want this lens to be implanted? Go elsewhere.
Go elsewhere. Yeah.
When you come to me, I will take your measurements. I will decide which lens is the best for you. Don't even ask me what lens importer may be implanting. Don't ask the company name and all that. I will decide based on performance, and I will decide based on what's the best for your eye. That's the way to go forward. We've been, as human beings, we are very brand driven, right?
Yeah.
If you go online and you look up best intraocular lens, you will see lens 1, 2, 3, 4. But that's probably not the best lens for your eye. That lens is popping up because that manufacturer has modified the search engine on the website to make that appear first. It's nothing to do with performance.
And sir, it is very surprising that sir, there are companies who don't use quality in marketing, and those are Japanese.
Yes.
Americans use quality in marketing. But sir, customers don't form opinions on the basis of quality in marketing.
Yes.
They base their opinions of the quality of the product or the service.
Exactly. And this is one of the reasons why women pay lakhs of rupees to buy a Louis Vuitton bag.
Right.
There's nothing in that bag that's very special from other bags. It is just that logo. It's a branding, the image.
Right.
But the performance between that bag and another bag that costs a few thousand rupees is probably the same, or the 1,000 rupee bag is even better. Right? It's kind of the same thing with these lenses now. And as our population gets more tech savvy, this is a challenge we're facing. I get patients who come to me and ask, I want XYZ lens implanted in my eye, where I know if I put that lens in, he's going to be miserable. So that's the challenge we're really facing nowadays, and hopefully it does change where the patient starts to trust the doctor better with their judgment instead of medical company that is commercially invested in pushing the lens out.
Thank you so much, sir, to be on this podcast. It was a wonderful conversation with you.
Yeah. Thank you so much. I think you're doing a great job. I've been following your podcast clips now, especially. They're going viral on Instagram.
Thank you so much.
Very informative both for ophthalmologists and for the general audience.
Thank you so much, sir.
Thank you.
And sir, even you have started just make this a culture.
100%. Yeah. Right.
Thank you so much, sir.